and welcome to NHIS in a week where we give you the happenings and the highlights in the authority and the scheme. My name is Shanice Palm. Now to the headlines. Parliament approves 10.7 billion Ghana cedis for NHIS. Co-payments among service providers will soon be eliminated, NHIA assures. And NHIA launches nationwide cybersecurity awareness training. To our first story, Parliament has approved a 10.7 billion Ghana cedi allocation for the National Health Insurance Scheme for 2025, marking a significant financial boost and the fulfillment of a major campaign promise. This comes as a part of the 2025 appropriation bill following a closed-door session with NHI officials led by CEO Dr. Victor Asare Bampo.
The newly approved allocation reflects an increase of nearly 4 billion Ghana cedis over the 2024 figure, driven by the government's decision to uncap the National Health Insurance Fund. Of the 10.7 billion Ghana cedis, 6.56 billion Ghana cedis is earmarked for claims payments, 1.23 billion Ghana cedis for NHIA operations, 2 million Ghana cedis to support dialysis treatment for vulnerable patients, and 984 million Ghana cedis for the Ministry of Health. Health Minister Kwabena Minta Akando emphasized that this move supports the free primary healthcare policy and the Mahama Cares initiative, filling funding gaps caused by the donor withdrawal. Dr. Bampo reaffirmed the authority's commitment to transparency, robust internal controls, and efficiency, stating that increased funding requires stricter accountability. The decision to uncap the NHIF was originally announced by Finance Minister Dr. Ato Folsen in March 2025 and hailed as a landmark shift towards achieving universal health coverage.
The National Health Insurance Authority has launched a nationwide cybersecurity awareness campaign, starting with the Western region, to boost digital security and protect sensitive health data. The inaugural session held in Takoradi brought together NHIS staff and cybersecurity experts to train participants on social engineering, access control, multi-factor authentication, and safe online practices.
Led by NHI's Management Information Systems Directorate and partner Xylo 360 Cyber Security Ghana Limited, the training stressed the importance of preventing human error and maintaining system integrity. Acting Regional Director Mr. Joseph Akpo encouraged staff to take the initiative seriously, while MIS Acting Director Mr. Vitus Kalio warned that a single error could compromise the entire data ecosystem.
There are a lot of things that you've even learned on your personal levels to protect your own laptops and whatever you do internally for yourself personally. And then what if you do will come as a risk to the organization. The key thing is that don't let a flip, a small thing that will do put me and you out of job. And to put the government also in a very big bad end. That's how big the responsibility is.
Mr. Nathaniel Ayete of Xylo 360 delivered technical sessions, reinforcing that cybersecurity is a shared responsibility in the digital age. This initiative marks the start of a national rollout aimed at safeguarding NHI's expanding digital infrastructure.
Moving on, the Acting OT Regional Director of the NHIA, Mr. Julius Nelimo, has given strong assurances that co-payments at NHIS accredited facilities will soon be a thing of the past. Speaking during the region's 2025 first quarter performance review, Mr. Nelimo said efforts are underway to eliminate unauthorized charges that burden patients, especially in underdeserved communities.
The NHIA is ramping up monitoring and engagement with health providers to enforce free service delivery under the NHIS. Mr. Nelimo also emphasized the region's alignment with national health goals, particularly the Mahama Cares and Primary Healthcare Program. The meeting highlighted two major staff-focused policies, the CEO's new scheme of service for career development and the establishment of a staff credit union to enhance financial security. Staff warmly welcomed these reforms, and the event concluded with plus for the KJB District NHIA team, who ranked third nationwide in the 2024 Performance League.
The acting regional director for the NHIA Northern Region, Mr. Alhassan Abdullahi, has told all 14 district officers under his oversight to assess operational challenges and connect with staff. Since assuming office in April 2025, Mr. Abdullahi has engaged teams on the ground to discuss performance bottlenecks such as staff shortages, IT connectivity issues, inadequate office infrastructure, and gaps in key administrative roles.
Mr. Al-Hassan Abdullahi emphasized the importance of teamwork, leadership motivation, and ongoing stakeholder engagement to drive regional progress. During the tour, he also discussed establishing new offices to better serve under-resourced areas. With experience as a former monitoring and evaluation officer and district manager, Mr. Abdullahi pledged to position the region as a top performer in NHI's national membership campaign.
To our next story, the acting regional director of NHIA for the Savannah region, Mr. Kasimu Abdullahi, has wrapped up a week-long formalization tour aimed at reinforcing stakeholder collaboration and improving healthcare delivery.
The tour included visits to Sola Tuna Kalba, Bole, Central Gonja, and East Gonja districts, where Mr. Abdullahi met with NHIA staff, MDCs, health directorates, and credential facilities. He advocated for zonal offices to expand access, encourage greater enrollment of vulnerable groups, and called for strict adherence to NHIS approved tariffs. Healthcare providers commended NHIA for timely claims payments, and Mr. Abdullahi promised to address lingering operational challenges. He stressed that achieving universal health coverage by 2030 will require teamwork, stakeholder trust, and a patient-centered focus.
This week, the NHIA brings you an important reminder on how to protect yourself and your family during the rainy season. Here's your NHIS rainy season message. As we enter the rainy season, NHIS reminds all members to take steps to stay healthy. Sleep under insecticide-treated mosquito nets, drain stagnant water, and seek early treatment if you feel unwell. Together, let's fight against malaria and any other rainy season diseases.
You should see me rough off. I don't understand. I hope you've been taking your medication. Ajo better. Hey, foul. Now say be pedroni boarding.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith in you. Listen, let me tell you, there's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the Power Fee, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes! You can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier. National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
That's all that we have for you in this week's edition of NHIS in a Week. For more stories, do visit our website www.nhis.gov.gh or do visit our various social media handles displayed on the screen. My name is Shanice Palm. Do have a lovely week.